One of the more common shoulder injuries that we've diagnosed in the last decade or so is called a slap tear. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. What is a slap tear? I think that this is one of these things that we're recognizing more and more, probably because we do more MRIs than ever before. And so the question gets to, do you have a slap tear? And if you do, what should you do about it? First of all, a slap tear is an acronym. It stands for Superior Labrum Anterior to Posterior. You probably don't care about that. You certainly don't need to know what that means, but it's a tear or an injury to the labrum, the cartilage bumper along the socket, toward the top of the socket where your biceps tendon attaches. You can see it in throwing athletes like baseball pitchers from the repetitive extension, or I should say abduction and external rotation over and over and over again. You can see it in contact and collision sport athletes that get tackled and their shoulder driven into the ground. But you can see wear and tear of the labrum in manual laborers or people that just like to do physical activities, and you can get some fraying of that labrum over time. Typically, it's sort of a vague pain. You might notice this dull, achy pain, and if you think about it, it's deep in your shoulder. That's in my experience where I get them to localize it, because it's not here or here or here anywhere specifically, but they'll say it feels like it's deep in their shoulder. You might notice popping or clicking or catching deep in your shoulder. But it may just be this achy discomfort that you can't really describe. There's a number of physical exam tests that we can do in our office, but the problem is no one test is perfectly diagnostic for it. Some certainly suggest it, that plus your history might clue us in, but it can be difficult. X-rays are usually negative, and if we're concerned that that's what you have, we might consider getting an MRI. Now, better than a plain MRI where you just lay in the tube and they shoot the study, we like to do what's called an MR arthrogram, where the radiologist injects some fluid or contrast into your shoulder before the MRI, and that fluid or the contrast travels up under the labrum between the glenoid or the socket and the labrum to show you that there's a tear. I think that's a much better test. It is uncomfortable for a few days, but that may be worth asking your doctor about. Should you get an MR arthrogram as opposed to an MRI? Now, because there is, what we think to be a fairly high false positive rate with these injuries, plus that may not be the source of your symptoms, a lot of times we'll recommend physical therapy first, sometimes even before getting the MRI. Because working on shoulder strength with rotator cuff and strengthening the muscles around the shoulder blade, working on your mechanics, things like that, that may be enough to get you better. And if it is, terrific, you avoid surgery. Occasionally, especially in young active people with an unstable labral tear, a lot of times we do talk about surgery. We'll do it arthroscopically, and that surgery may just be going in and smoothing out the labral tear with a shaver, or it may be reattaching the labrum with stitches and an anchor or multiple anchors. That labral repair, slap repair, has a long recovery. The surgery may only be 30 minutes or an hour, but the recovery can be 4 to 6 months because you have to protect the repair, so you limit shoulder motion, especially in certain directions, and then you slowly work to regain motion and regain strength. So working with a physical therapist for months really is necessary to get that to completely heal. The surgery success rates are good, but it's a long process. So that's sort of my overview of superior labral tears. Have you had a slap tear or superior labral tear? What symptoms did you have? How did your doctor diagnose it? And how did you get better? Below this video, describe all that, because I would love to read it, and I bet people watching this video all around the world would love to learn from your experience as well. Now, I record several of these videos every single week, and I've started doing live videos where I interact with people and answer questions. So subscribe to my video channel. Click the subscribe button in the upper right corner of the page, and you'll get notified when a new video is out or when I'm online. I think that can be really helpful, and I'd love to interact with you that way. Thank you so much for watching. I really hope this video was helpful, and I look forward to seeing you right here next time.